Good afternoon, everyone. Thank you for joining us today. My name is Sophie Reyes, and I am the Marketing Director at Best Buy Medical, and I'm super happy to be your host. Today, we're excited to partner with BIOS Medical to discuss the benefits of home blood pressure monitoring and how we can help patients take a more active role in managing their health. I'm pleased to welcome our speakers, Cambria Brown and Trevor Parker. If you have any questions during the webinar, you can write them in the chat and we will answer them at the end of the presentation. Please note that this webinar is being recorded and will be available on our YouTube channel in the coming days. Thank you for being here and I hope you enjoy the webinar. Cambria and Trevor, please go ahead.
Hello, everybody. Can you all hear me? I think that you can. Perfect. Okay, well, thank you all for joining today. As Sophie mentioned, we are from BIOS Medical. I am the National Key Account Manager for BIOS. I started as a rep with the company about 4 years ago. So some of you might recognize me. I might have been in your pharmacies or home healthcare locations. I have with me today our VP of Marketing as well, Trevor Parker. So if I at any point don't know a question or anything, he's going to help me out with it. He is our BIOS blood pressure expert for the day. So without further ado, we'll get into the webinar. So the goal for today's webinar is so that you become aware that your recommendation makes the difference when recommending blood pressure monitors to your patients and customers. So BIOS is a 100% Canadian owned and operated company. Whenever we create a product, we 100% have the Canadian consumer in mind. Some learning objectives for today is to understand Hypertension Canada's guidelines for out-of-office measurements and recent updates to target blood pressure levels, learn proper home monitoring measurements, apply information about our devices, their algorithms, and proper validations to common situations with patients and concerns about device accuracy, understand the overall importance of a patient with hypertension beyond just medication, as well as learn about BIOS blood pressure monitors and how they can help you and your patients with home monitoring. This is actually where we started in 1930. So this is Taylor Instruments, which is BIOS or Thermor, which is our name, before it became Thermor. So this is way back when in 1930, and we just started with instrumentation. Now, today, we've obviously developed into blood pressure. We have assisted daily living products, home health care, fast safety, everything. But today, of course, we're just going to be focusing on the blood pressure monitors. As mentioned, we started in 1930. In 1973 was actually when the first blood pressure kit was created. And this was actually made because end users wanted to take their health into their own hands and start monitoring at home. So this is our first unit. It was a manual blood pressure monitor. In 1983 was actually when the first digital home blood pressure monitor was developed, and that's what it looked like. So Hypertension Canada is pretty much the governing body behind blood pressure, as I'm sure you are all aware of. In 2023, our VP of Sales, Jennifer Pulis, was actually awarded with the Hypertension Canada Certificate of Excellence. So we just want to bring recognition to that because we work very closely with Hypertension Canada, and so much so that we actually had the honor of winning the award. Okay, poll question. So this is our first one of the day. So we want to make sure that you all are paying attention and listening. So the first one is just what is your role in your current either pharmacy or home healthcare store? I believe that the poll question is going to come up on your screen. So we'll give you guys a few minutes there. Okay. Amazing. So, okay, we have pharmacists and home healthcare store customers as well. That's perfect. Okay, amazing. So that was just to kind of figure out who was on the call and just get a better understanding of who we're talking to today. So hypertension is the largest epidemic known to mankind, and we're going to get into that. So some important stats that you might not be aware of. Canadian adults that are living with hypertension today represents about 8.2 million people. That age group most affected is those 60 to 65 and over. So it represents about 60 to 80% of those affected by hypertension. The annual deaths linked to hypertension and cardiovascular disease is about 71,000. And then the economic burden in Canada from those patients that might not know they have hypertension or are aware of it is more than $13 billion. So this represents a massive market opportunity. So over the next 5 to 10 years, 10%, well, it will grow, the demand for it will grow about 10% for the next 15 years. Peaking, sorry, in the next 5 to 10. I totally read that wrong. I'm so sorry, everyone. Canadian physicians are recommending home monitoring to diagnose, adjust meds, and monitor lifestyle. So they really have, in the past few years, recommended that you monitor at home to take your health into your own hands. As of 2025, 2026 year to date, Canada's population is about 41.5 million, with 33 million being adults, so those 18 and over. 1 in 4, so about 25% of Canadians are hypertensive, and that represents about 8.2 million, according to Stats Canada. More than half of Canadians aged 60 plus have hypertension. So going back to that stats chart that we saw in the previous slide, obviously that's pretty much the biggest demographic that is affected by hypertension, and that's the blood pressure market sweet spot, and really why we want to bring attention to this, so that you know that that baby boomer generation, they are the ones that want to take their health into their own hands, and they are the ones that are really in that blood pressure sweet spot. So making sure you have these units in your pharmacies and home healthcare stores would be really beneficial for you, and that's why it's a big market opportunity. So let's go into some blood pressure. I have a question for you. So we have another poll. It will come up on your screen here shortly. So how many people in your life currently are aware they have hypertension? We'll just wait for the answers to come in. Okay, amazing. So majority of the responses were about 1 to 3 people they know have hypertension. So that's pretty alarming. That is a significant amount of people. Obviously, that's why it's great to make sure you're aware of your blood pressure, and that's really why we want to bring awareness to this today. So again, those stats are pretty alarming. The fact that 1 to 3, everyone on the call knows about 1 to 3 pretty much people affected by hypertension is pretty alarming. I'm not sure, I can't bring the results back up, but I don't think there was anyone that said no one. So yeah, there's that. Okay, so going into blood pressure, what is it? The basics of it. So blood pressure is the pressure of blood pushing against the walls of your arteries. Your arteries carry blood from your heart to other parts of your body. It is normal for your blood pressure to rise and fall throughout the day. That's normal. It's very common depending on your lifestyle, what you're doing, the fact that you're eating, having medication, all those factors are going to affect it. So your heart and your blood pressure, it is all part of your circulatory system. So the heart pumps blood through the body. Your arteries carry oxygen-rich blood away from the heart, and your veins carry oxygen-poor blood to the heart. The heart is separated into 2 parts, which is what the diagram on the left-hand side here shows. The left part of your circulatory system is when the blood goes from your lungs and pumps into your body. And then the right side is when blood goes from the body and pumps into the lungs. So it's represented in that diagram there on the left-hand side. And then that's your circulatory system. So there's two numbers that when you're monitoring your blood pressure, it will pop up on your blood pressure machine. So at the top number is your systolic. So that is when your muscle contracts. So if you're taking it, let's say just an easy way to look at it is when your heart is just beating. So it's that contraction. Your diastolic number is when your muscle, the heart muscle, relax. So it's that split second in between that heartbeat. It's just that split second where the pause is. It's your diastolic number. So your diastolic number remains pretty consistent, whereas your systolic number can jump up and down. That's why when you're taking your blood pressure, no two readings will be the same. It will most likely jump around. And when you first take it, it will be, your systolic number will probably be higher. And then as you sit there, it's recommended you take it about 2 to 3 times, it will lower. But that's the two numbers that you'll see on your screen. So there's two different methods of monitoring. The first being manual, and that's kind of what we started with way back when in the early 1900s, 1970s, I believe it was. So that's the manual ones. That's still done a lot of times with nurses and doctors' offices. It's not as recommended now. It's a great resource, but the automatic one is actually what is being recommended by Hypertension Canada and doctors today. So we have another poll question. So recently, if it will pop up, but recently Hypertension Canada and the World Health Organization have changed the guidelines behind what is qualified as hypertension. So on your screen, you'll see 4 different options. If you guys can go in and choose what you think is qualified as hypertension, that would be great. Give you guys a few more minutes or seconds. Amazing. Okay, so the answer was 130/80. About 47% of you got that right. So that is the correct answer. And that was just recently changed. Okay, perfect. You guys know your stuff. Okay. So this is a chart that breaks down the actual classifications of hypertension. So at the top here, you'll see 120/80. That is what's technically qualified as being normal. That's the range you want to be. Obviously, it's going to be different for everyone. Elevated is 120 to 129, and then less than 80 for your diastolic. Stage 1 hypertension, so like we just did in that question, 130/80 is the new parameters behind what is qualified as hypertension. And then anything 140 or over, that's actually when you really want to start taking it into consideration and make sure you're going to your doctor and keeping a close eye on it, because that's what starts to become known as hypertension and raised levels. So what is hypertension? I keep saying it, but what is it? So hypertension, aka high blood pressure, is a measurement, like mentioned, consistently above 130/80. Hypertension must be measured because it rarely demonstrates symptoms. So on the left here, we have a little picture. It says, I don't make noise, I don't show up, but I take lives. And that is because, again, there's no symptoms that really come up for hypertension. It is the silent killer, and that's what it's known as. And that's really why your recommendation on blood pressure monitors matter. And that's why you want to make sure that you're encouraging your customers and patients to make sure they're monitoring consistently. Why does blood pressure increase? So a lot of times it does increase with age, and that's what we saw in that chart, was those aged 60 to 65 were mainly the ones where it was starting to affect them, and it was the larger age group, and then from there it just becomes more, and that's because, again, age is a big factor. But it's when your blood vessels narrow as plaque builds on the walls of the arteries. As a result, your heart works harder to pump blood through the blood vessels, and this causes the pressure in your blood vessels to increase, and that's what causes high blood pressure. So in these little diagrams here on the left, you'll see that there is a buildup of plaque. This is your arteries, and there's a buildup of plaque inside. So when blood is pushing through, it makes it harder to get all the way through, and there's more pressure working in behind trying to push that blood pressure through it, trying to push the blood through it. Oh. So there are 3 measurement recommendations. The first being out of office. So this is when you go to the doctor, you might be qualified as having hypertension, and that might be because you sat in the doctor's chair. As we all know, doctor's offices, it can be a lot. There's a lot of pressure there. You might have white coat hypertension. So in that case, they might send you home with a 24-hour ambulatory reading. So that's your first option on kind of monitoring your blood pressure to see what your levels are and what your baseline is, and if you need to go on to high blood pressure medication or if you're still good. The second is home monitoring. So this is when you go home, you have the blood pressure monitors at home and you're consistently monitoring daily at the same time of day, hopefully, and just being very consistent with it. So then you can bring your results into your doctor and say, hey, I'm monitoring at home. These are my results. That's your alternative option there. So that's the second one. The third is an office measurement. So this is a manual reading done in the doctor's offices. It can also be technically, if they do have a machine that is automatic, that's a great alternative option. But again, white coat hypertension does take effect in that case. But for the manual one, if you are taking it at your doctor's office and they have the manual one, there is a chance that it will be higher. And that's because when they're taking it through the manual reading, they're listening for the beats. And then there's a chance that obviously it's not as accurate as the automatic one, because just based on everyone hears things differently, and it all depends. So it's not recommended as much, but these are your other options as well. Okay, wrist unit. A lot of times people don't think that the wrist unit is as accurate as the upper arm cuff. That absolutely was the case back in the day. However, our wrist units have been studied, tried, and tested, and Hypertension Canada has approved them. So they now endorse them. As of 2018, they actually changed their kind of parameters on it, and that's when they started endorsing it. It's not for everyone. A lot of people might not like it still, but those that have a larger arm or a very, very tiny arm and they might bruise easily, they don't like the upper arm cuff, it's painful for them, this is a great alternative option. Your wrist is more durable in a sense, and it's not going to tighten doesn't feel like it tightens as much. It's also great for anyone that has lymphedema, a breast cancer patient, anyone that has had their lymph nodes removed. It's a great alternative option. It just makes sure that the patient can continue to monitor, and it is just as accurate. It's been tried and tested, so it is just as accurate, I guess, is the biggest point we want to make sure that we're communicating here. The traditional method is out. So just monitoring every once in a while from your doctor's office, it's not recommended anymore. You want to make sure that you're monitoring consistently to make sure you're getting the most accurate results as possible, and you're not just being maybe potentially diagnosed with hypertension when you might not actually have it. It might just be a one-off at the doctor's office because you have white coat hypertension. So having a unit at home is really what's been recommended, and that's what we want to make sure you're recommending to your patients and customers as well. There's many factors that influence blood pressure. I won't read them all, but medication, caffeine, alcohol, time of day, hormones, mental stress, emotions, pain. Funny enough, hot tubs, bath, and showers, moving or talking during measurement, that's a big one. Environment, temperature. So there's lots of things that do actually affect your blood pressure. And then age is also, of course, like we mentioned, a big one, and that's what's shown in the bottom picture here. Prepping for a measurement. Okay. This is a big fact that I want to make sure that you are all aware of, is that how someone takes their blood pressure is going to have a big impact on their readings. So this setup here is exactly how, when you are telling your customer to monitor, how we want them to be set up. As I mentioned, device accuracy is not enough. How and when you measure is critical for reliable data. Proper ways of taking blood pressure. So ideally, you have 2 times of the day where it's recommended you take your blood pressure readings. Either in the morning, first thing when you wake up, before coffee, tea, medication, food, a few hours like before just your day pretty much starts. You want to make sure that you're still pretty calm, ready before the day even begins. You also want to make sure that you go to the washroom before you take your blood pressure, because it can actually give you false hypertension. So in the morning, you can also take it in the evening as well, about 2 hours after dinner, before or after exercise. Just give your body some time to decompress from the day and then take it. Like I mentioned, empty your bladder if necessary, avoid coffee, smoking within an hour, no exercise 30 minutes before measuring. And you want to make sure you're taking your blood pressure on your non-dominant arm unless the difference is greater than 10 units above what the other arm is. When you're taking it, you want to make sure you're seated with your feet planted on the floor, your back supported. You want the cuff to be at heart level, so not down at your forearm unless it's recommended by your doctor, nothing like that, unless it's a wrist one, of course. You want to make sure it's at your heart level without any muscles being engaged. You don't want to be speaking, so sitting silently, pretend you're on vacation somewhere. Sit with your legs uncrossed and your feet flat on the floor. And you want to rest for about 5 minutes before you take the measurement. And then while you are taking the measurement, you just want to make sure you're in a quiet, relaxing environment as much as possible. Cuff sizing is very important for accurate readings. If you have an undersized cuff, it actually overestimates the blood pressure value, so you're not going to get an accurate reading. Our units have extra large and extra small cuffs available. That is something that if you're ever looking or your customer needs an extra small or extra large cuff, it is available for them to purchase. It just depends on their arm size. And again, they can also purchase the wrist unit as well. And we'll get into all this soon. But just so you know, you also want to make sure that your customer is not taking the reading on their shirt. So you want it on their skin, ideally, when you're monitoring. And if it's on top of your clothing, it can actually, the results can give you pretty skewed answers. So you want to make sure that it's on your skin. Okay, putting the cuff on properly. So like I mentioned, you want to be seated, feet planted on the floor. You slide the cuff up your arm, and there's a little red piece on we call them our D-ring cuffs. So this piece here, the little red icon, you want in line with the inner part of your elbow, and then all tubing would be going down your arm and connecting to the device. When you tighten the unit, well, the arm unit, you want to tighten it so that there's about 2 to 3 fingers between your arm and the cuff, and about 2 to 3 fingers above the break in your elbow. And then As soon as you have it all positioned properly, it's tightened, everything's good, you just plug it into the unit, you turn it on, and you're good to go. All of our units have been, like I mentioned before, approved by Hypertension Canada. They all have this seal on them that says Hypertension Canada, recommended by. This, in the past, they used to have levels. So there was silver, there was gold. All of ours have been tried and tested, and they're pretty much all of gold status, even though that's not technically the parameters anymore. It's all just recommended by Hypertension Canada. But again, they've all been tried and tested, and they are just as accurate as possible. So that's very important to know when you are talking to your customers about these, making sure that they're aware of this, and the importance of being validated by Hypertension Canada is huge. There are 2 of our units currently that have the ability to connect to our app. So it will bring all your systolic, diastolic, pulse rate, all that information will go directly to your app as soon as it's set up. It's free with the purchase of our blood pressure units, and it's available through Apple, Google app platforms. It's very easy, and a lot of times some elders are like, well, why would I want this app? That I don't like technology. That's totally fair, but a lot of times if you have a parent that has a caregiver, you want to make sure that they're monitoring properly at the proper time of day. You can log on with their credentials and you can make sure that they're monitoring and what the readings are. You can also take those results and email it to your doctor and just make sure that everything's good, or you can print it off, whatever works best. But that is the great part about the app, is having that opportunity to print off and email and log on and make sure that all of the results you're getting are as accurate and in the parameters that they should be. On to the units. So we have a bunch of different features in all of our monitors. These including, we have a 7-day protocol, which we'll get into, averaging, which is great, irregular heartbeat detection, atrial fibrillation detection, a blood pressure assessment indicator. So that will actually show you where you are in relation to Hypertension Canada's guidelines based on your results, along with the MediLink app. Some of them have as well. So this is our full lineup here, and we'll go over each one. But starting on the far left-hand side here, these are kind of our more simple units and more cost-effective. This one here is our bestseller. And then from there, the features increase and they do become a little bit more expensive, but it just depends on what the person is looking for. And then we have our wrist unit at the end here. This chart kind of breaks down all the features of each as well, and we'll get into all of it, of course. But first, we have a poll question, so I'll direct you all to your screen. Oh, it pops up. So do you currently have BIOS blood pressure monitors in your pharmacy or store? Don't lie, people. Okay, we'll just wait for the results. Yes, so good. Okay, so about 86% of you have BIOS blood pressure monitors in your store. That's awesome. I'm so glad to hear it. Okay, perfect. Amazing. So we'll run through each unit just so that you all can get a better understanding of them and the different features. If you have any questions on any of these, we can take questions now or at the end, whatever works best. Maybe just take note of the product number, and we can of the product number for the blood pressure monitor that you might have a question on, and then we can talk about it at the end.
Cambria?
Yes.
If you want to make a quick pause, we've got 2 questions, so I can
Of
read
course.
them now.
Tell me. Yes.
So we've got a question from Sandy, who said, in the past, I have been told the left arm is the one to measure due to proximity to the heart. Do left-handed people measure the right arm?
That's a good question. Trevor, do you have an answer for that one?
Hey, can you hear me? Can you hear me? Yeah?
Yes.
Yep.
Okay, perfect. That's a good question. I would suggest, based on the recommendation of using the non-dominant arm, then yes, a left-handed person would tend to use the right arm. What we often suggest to people when they are measuring at home, because a lot of the time they're going to take these measurements, they're going to bring them back to their healthcare professional, they're going to talk about it. We tend to suggest that they measure on the same arm that their healthcare professional would. So whether that's a pharmacist, a physician, a nurse practitioner, that's at the end of the day, that's what we would suggest, because as Cambria mentioned, you can have a difference in millimeters of mercury between the left and right arm. So if your healthcare professional is measuring on the left, but then you go and measure on the right, we're not speaking apples to apples when we go back to see that professional. So that I think in general is what we would suggest. To come back to the question, if a left-handed person isn't actively or regularly meeting with a healthcare practitioner, if they're just keeping track, but they don't necessarily have hypertension, but they're just keeping an eye on it, then I'd come back to what Cambria explained and go with the non-dominant arm. I hope that helps.
Thank you very much. So Cambria, you can continue your presentation. Thank you.
Perfect. Amazing. So this unit here, okay. This unit here is our simplicity unit. It is our most cost effective. It stores 20 readings. It's meant for one user. That doesn't mean just one person can use it. For all of our units, we recommend keeping a written log to make sure that you know your results and what time of day. And of course, technology sometimes can be a little bit finicky. So just keep a written log just in case. So multiple people can use it. Just write down whose results are whose so that you have a better understanding. If one person is reading it, though, it does average out all the readings, and that's why it's mainly recommended for one person, is so that then when they go to their doctor, they can take the average of all the readings on the unit or the last 3. They can do it manually and figure out the last 3 readings, or they can clear their memory space as well you can either take the batteries out or you can clear the memory space as well. And you can take 3 readings and then it will average out those ones because it will average out everything on the unit. So this is a great one, especially if you're traveling. It's compact. It doesn't come with an AC adapter, but it does have the opportunity for you to buy an adapter separately. So again, this one's our most cost effective. This one is pretty much the same as the last one. The main difference being this one has Bluetooth capabilities. So this is one of those ones that can connect to the MediLink app and you can track all the information. This one is also very cost effective. It also doesn't come with an adapter, but it's still great because you can buy the adapter separately, but it still works just as well with the batteries as well. This is our best seller by far. And if you have them in your pharmacies, I'm sure, and stores, I'm sure that you've probably noticed that these ones do very well for you. It has a large blue light display. It also can store memory space, 90 measurements for 2 users. So you can switch between user 1 and user 2. This is that little chart I was talking about as well. Once you get your reading, this little chart on the side will show you where you are in comparison to Hypertension Canada's guidelines. So 119/78, obviously that's great. 120/80 is what's recommended by Hypertension Canada. So this person would be in the green. It's all good. If you can see at the bottom, there's a little squiggly line. So this one and the 2 before it actually monitor for a regular heartbeat. If you're monitoring and you're getting this little squiggly line pretty consistently, that means that the unit is detecting an irregular heartbeat, and that's when you'd want to bring it to your doctor's attention. This one also comes with an adapter as well. So this one has an adapter, or it can be battery operated, either or. This one's actually pretty new for us. I personally really like this one. It's an all-in-one unit. So there's no tubing, there's no secondary. You don't have to have a unit and a cuff. Everything's connected all in one. So you slide it up your arm. This little red piece is in line with the inner part of your elbow, and then you tighten it like normal. You turn it on and you're good to go. You can start monitoring. It takes the average of the last 3 readings as well, if I'm not mistaken. And then it also has the irregular heartbeat detection. It has that chart on the side, and you can just access the memory through this little memory portion here. You just click the button and it will bring you back up to all your memory space. So this one's, it's around the same pricing retail as the Easy Read unit that we just looked up as well. So this one's been doing really well for us as well, and it's great for travel also. This one is new for us too. We call it our balance unit. So this one's pretty cool. It can actually detect your stress levels. So there is a direct correlation between high blood pressure and high stress levels. You don't do them both simultaneously. You take one and then you take the other. So the first being your stress levels. You can start with that one. And then from there, you press the PS button. Based on your stress levels, if you have lower stress or if you're in the middle, you'll have a smiley face. And then from there, as you potentially increase on the chart and your stress levels are higher, that little smiley face will turn into a not so smiley face. So then you can take your blood pressure and see if there is that direct correlation between your blood pressure and your stress levels. So that one's actually a great feature, and it's pretty cool if you ask me. It is just a regular USB-C cable as well. So pretty much any USB-C connecting port you can use to plug it in, and it can also be battery operated. This one does a regular heartbeat as well, detection. The next 2 are pretty similar. So they are, and I'll go over the differences soon, but they both have what's called a 7-day protocol built into them. The 7-day protocol is Hypertension Canada's guidelines. We've added the algorithm into our units. So over the course of 7 days, if you're suspected of having hypertension, you can monitor twice in the morning, twice in the evening in that 7-day mode. At the end of the 7 days, it will actually average out all your results so that you can then bring that into your doctor and they can check it all out and make sure, see if you need hypertension medication, if you have high blood pressure, or if you're in the clear. It's also not just a one and done situation. If you're on high blood pressure medication and you want to monitor to make sure your medication is still working properly, you can, once before you go into your doctor, you can monitor for 7 days before and then bring it in and say, hey, I'm on medication, of course. I want to make sure it's still working properly. These are my results over the course of the 7 days. This is the average. And it will, your doctor can then determine if any changes need to be made or if it's all good. So that's the great thing about the 7-day protocol. It's really, really handy. And then again, you're taking your health into your own hands as well. And you're not just, it's not the one-off where you go into your doctor and there you might have white coat hypertension. This one also stores 90 measurements for 2 users. So again, you can switch it between user 1 and user 2. It also has a regular heartbeat detection. So if it does detect an irregular heartbeat, that little squiggly line will appear. So this one is our BD240 precision unit. This one is our insight. So this one has the same idea of the 7-day protocol, but it has the ability to connect to the MediLink app as well. So the great thing about this and the 7-day protocol, so the app and the 7-day protocol being together, is that you can then take all those results from the 7 days, take the average, and you can email or print off all your results and bring it into your doctor so that you have everything pretty much right there instead of having to bring in the whole unit like you'd have to for the other one, or you'd have to bring in a written log or photos. At least in this case, you have the opportunity to just print it off, email it over, whatever works best. So we have this one. This one also has the irregular heartbeat detection. They all have different warranties on them as well. My customer service team, our customer service team is amazing. If customers ever have any issues and they want help on them, how to use it, how to set up, if they ever have any issues with it, we really want you as pharmacists and store owners, managers, to make sure that you're telling them to come back to us and call the number on the box or on the website so that we can help walk them through it, because it can be challenging. There can be little features that people might not know about, little tips and tricks. So make sure you're telling them to come back to us and ask us any questions that they might have, because we're more than happy to help any way possible. This is just some more information about the 7-day protocol. I went over most of it here. Okay, the next 2 units both detect atrial fibrillation. So atrial fibrillation and irregular heartbeat, it's a form of an irregular heartbeat, but they're not the same. So as you know, irregular heartbeat is it's a whole nother thing. Atrial fibrillation, if you have a family history of stroke or if your doctor's ever mentioned AFib, that's really when you'd want to direct them more so towards the AFib units. This one has a mode, which you can, on the side here, there's a switch. You can switch it to either 1 or 3. The 3 will measure 3 times in a row and then give you the average. And then it can, if it does detect atrial fibrillation, it will pop up in this little corner here with a little AFib icon on, yeah. It comes with a cord and it stores 200 memory spaces. So we have that one. This one also does atrial fibrillation as well. So it also has trending on the side. So what that means is based on your unit, well, based on your previous reading, the one that you might have just taken. So let's say we just take our reading and it's 120/80. If that is higher or lower, these little icons on the side is our trending, and it will show you if that's higher than normal or lower than your other readings. So it can make sure that you're on track, or if something might have changed and it's the middle of the day and all of a sudden it skyrockets, it will show you the little arrow will be upwards and it will show you that that's trending up and that it's a little bit different than what it's been in the past. This one also has a rigid cuff. So if anyone skis or snowboards and they have the boots that have a little dial on it, it's the same idea with this unit. You can slide it up your arm and you twist the dial to tighten it, and then you can, to loosen it, you'd pull it out and twist it the other way, and then you just slide it down your arm. So it's not the classic D-ring style unit. It's just a lot easier. You can just pull it up or push it down, tighten and loosen. It's very easy to use. You can also have 4 users using it and then have memory space for each of them. The wrist unit. So this is the final one we'll talk about in our home blood pressure monitoring ones. This actually comes with a carry case. So the idea for this one is, as I mentioned, it's just as accurate as all the other ones, but you want to make sure your wrist is at heart level. So the carry case is there so that you can slide it underneath your forearm. You turn the unit on, you wear it on the inside of your wrist, opposite of a watch. The number's facing you. And then honestly, you just slide the carry case underneath your arm, you turn it on and you're good to go. So then no muscles are engaged. The cuff is at heart level and everything. It would be the same as the upper arm cuff, just now it's on your wrist instead. So again, like I mentioned before, the ones that you'd really want to steer towards this one would be those who don't want to buy an extra large or extra small cuff, or if they have had breast cancer or lymphedema or anything like that, this is a great option to make sure that they're still monitoring and still getting accurate readings. We also offer office units as well. So the first being, this one can actually be used in a clinic. It comes with 3 different cuff sizes. You can pretty much put it on your patient in a clinic scenario, set it and forget it. You can set it up so that it takes 3 readings in a row or 5 readings in a row, whatever works best for you and whatever you're looking for. I believe, Trevor, sorry, can you pipe in here? Is it 3 readings in a row or 5 or both?
Hello.
Yeah.
It's 3 readings.
3. Yes. Okay.
But what'll happen is it can take up to another 2 readings if it needs to. So what that means is it takes a reading, the next one it doesn't get a good reading, it'll take another 2, so that ends up being 4. If there's another reading that's no good, it'll take up to one more. So that's what that one means. It'll take 3 good ones, and there's two extras if needed.
Right. Okay, perfect. Thank you so much. Yep. So we have this one as an option. It also comes with a stand if you'd like it as well. There's that option. We also have an ambulatory reading. So you can use this one as kind of more of a rental program where you rent it out for 24 hours to your patients or customers. And then from there, they can, after that 24 hours, bring that unit back to you, and they can bring those results into your doctor, and they can determine if they have high blood pressure or not. So that's a great option as well. If you're looking to get into the ambulatory program, we do have an option for that. Because you guys have been such great active audiences and answered all my questions and everything, we're actually going to give you a sneak peek into what we have coming out. So because we all are a smaller company, we can actively listen to what customers are wanting and what you are all asking for. And in this case, that's what we've done. We are coming out with a ECG unit, so it will detect your blood pressure and also your ECG levels. So on the bottom of the device, there's 2 little fingerprint areas where you put your fingers, and you'll press and hold them there. And then from there, it will then detect your ECG rhythms and give you a result at that point in time. So this has been heavily requested. It is something that we're bringing in soon. It does also do a regular heartbeat detection, and it will have access to an app as well, so that all that information will be displayed there. So this one is coming soon. We also have a talking unit coming shortly as well. So this is great for those who might be visually impaired or might just want a talking unit. We do have one coming out as well. So those are 2 new units to get excited about. They will be in stock soon, and your rep or agent will let you know when they are in stock, or you can remind them, ask them about it, and we will let you know kind of timeline and everything, but these are in development now. We offer screening events. So some of you might have had this in the past, where we will come out and we will educate end users on our blood pressure monitors and give them information about all of our units. Whatever questions they have, we can answer. And yeah, that's an option. So if you're ever interested in that, please contact your BIOS rep or agent, or myself. I'll put my contact information at the end here. And yeah, please reach out to us. So just in summary, why BIOS? We really make sure that we are listening to our customers' wants and needs and demands. So like that talking unit and the ECG one, we want to make sure that we are providing the best, most accurate monitors to our customers and making sure you all are confident with what you're selling to them as well. We have rep and agent coverage all across Canada from coast to coast. So if you ever have questions, if you ever want a rep to come in and see you, if they haven't already, please let us know. We're here to help. Our customer service team is great as well. Whatever you need, we are here to help with. And any questions you have, again, we are here to help with. And that leads me to my questions portion. Does anyone have any questions?
Thank you so much first, Cambria, for your nice presentation.
Yeah,
Really interesting. So I have a question about the wrist unit. If you want to go to the correct slide.
Do you want me to go back?
Yeah, if you want to. Are you able to go over parameters for wrist measurement trial versus upper arm cuff? You mentioned they were adjusted after Health Canada reviews.
What was the question, sorry?
It was the parameter. It's different between a wrist unit and the upper arm cuff. And she's asking basically what's the adjustment that they made.
Oh, just that it was recommended, so that they endorsed it. They, a lot of times in the past, the upper arm cuff was what was recommended, and the wrist one was said to be not as accurate. Hypertension Canada recently, though, well, I guess in 2018 now, adjusted their guidelines because they realized that the wrist one was just as accurate as the upper arm cuff and was a great alternative monitor for people that might need it. I don't know if that answers your question, but Trevor, is there anything else on that?
Yeah, if I could just jump in here, and yeah, everything you said, Cambria, is correct. The one thing that I think everyone needs to keep in mind is that the wrist unit needs to be used properly. And by that, I mean it needs to be at heart level when it's taking a reading. And you know, one very important thing that we've done with the wrist unit is within the retail box, it comes in a hard plastic case, and that plastic case is contoured on the top. So the idea being that the person measuring their blood pressure would actually rest their arm on the plastic case so that they can get it to heart level. So all of the 9 points that Cambria went through on how to properly measure your blood pressure, those are all the same for a wrist unit. The added is it's got to be at heart level. And we also don't want the person measuring their blood pressure to physically be holding their arm up, because you know, that's going to engage the muscles and it could restrict blood flow and it could affect the reading slightly, which again is why we created the case so that they could rest their arm comfortably on that case and get to heart level. If it still needs to be adjusted more, I mean, we recommend using really anything else that they can rest their arm on. So pillows, books, anything like that. The key is unit at heart level and not using muscles.
Thank you, Trevor.
Of course.
Next question is on BD360.
Mm-hmm.
The question is, how does it measure stress and in what type of measurement?
Can you guys see that?
Yes.
Perfect. Okay. So it is a stress indicator. It's based on your pulse rate, I guess you can say. We have what's called the PSI, which is our physical stress index, and that is what is being used to measure that pulse rate. I just want to make sure that I'm not misspeaking, but it's based on your pulse rate is what is going to give you that kind of where your stress level would fall. Again, Trevor, if you have anything to add on this one.
No, I think you covered it, and you mentioned it before when you were speaking about the unit. There's two platforms on the underside that they would place their fingers, and that's where they're getting the reading.
Thank you. Last question for now. How does the ECG function work without a lower limb lead on the upcoming BP?
So for this one, Trevor, I'm going to have to direct that question to you too. So this one is still new for us. We're still in the development. There's still things we're working out, but Trevor might have an answer to this one. If not, we can always look into it and get back to you guys.
Yeah, this one actually, sorry guys, everyone, I misspoke on the physical stress indicator. This is the unit that has the two pads on the back. My apologies. Yeah. But that's how it's measuring the ECG. This one has to be used with an app. I don't know, Cambria, if you mentioned that.
Yes. Yeah.
Okay.
This one has the app. Yeah.
Apologies. Yeah. So it has to be used with the app to actually see the reading. But as Cambria said, it's still in development. So we're hoping to have this available this year. We're targeting late 2026. But it could very well flow into early 27. It is a very new technology on a blood pressure. There are home use portable ECG units out there, but something that's incorporated to a home blood pressure unit, it's new technology, and it's new for us. So we're taking our time and making sure that everything's done correctly, and once it's available, as Cambria's mentioned, our salespeople in the field will have full training on it, know how it works, and be able to speak to it to everyone out there.
Yeah, thank you.
I don't know if we have more questions. I don't know if you have more questions, but it was super interesting. Thank you very much. Does anybody have a question, maybe in the audience, or is it okay for now? Anthony, do you see any questions?
Oh, actually,
No?
there's a new one.
Ah,
Oh, no, it's just an answer. No worries, I was just interested in the science behind it. Might be interesting in a community paramedicine aspect.
okay, cool.
All right.
So
Yeah, for
anyway,
sure.
the webinar will be available soon on our YouTube channel, on the Best Biomedical channel, so people will be able to review it and yes, learn more. So if we don't have any more question, I think we can just leave it there and say thank you to you, Cambria, Trevor, and Anthony, and of course to all the people who joined during this session.
Thank you all so much. And all these units are available through Best Buy as well. And if you have any questions, again, the contact information is there, but let us know if you have any questions at all.
Thank you very much.
Perfect.
Thank you,
Thank you
everyone.
all so much.
A great
Thank
day.
you. Have a
Bye.
great day.
Bye.
Bye-bye.